Today, let's compare P2Y12 inhibitor or aspirin monotherapy for secondary prevention of coronary events. Aspirin is the only antiplatelet agent with a class 1 recommendation for long-term prevention of cardiovascular events in patients with coronary artery disease. There is inconsistent evidence on how it compares with alternative antiplatelet agents. The objective of this study is to compare P2Y12 inhibitor monotherapy versus aspirin in patients with coronary artery disease. The method includes a patient-level meta-analysis of randomized trials comparing P2Y12 inhibitor monotherapy versus aspirin monotherapy for the prevention of cardiovascular events in patients with established coronary artery disease. The primary outcome was the composite of cardiovascular death, myocardial infarction, and stroke. Pre-specified key secondary outcomes were major bleeding and net adverse clinical events. Data were pooled in a one-step meta-analysis. Coming to the result, patient-level data were obtained from 7 trials. Overall, 24,325 participants were available for analysis, including 12,178 patients assigned to receive P2Y12 inhibitor monotherapy, clopidogrel in 7,545, ticagrelor in 4,633 patients, and 12,147 assigned to receive aspirin. Risk of the primary outcome was lower with P2Y12 inhibitor monotherapy compared with aspirin over 2 years, mainly owing to less myocardial infarction. Major bleeding was similar, and net adverse clinical events were lower with P2Y12 inhibitors. The treatment effect was consistent across pre-specified subgroups and types of P2Y12 inhibitors. To conclude, given its superior efficacy and similar overall safety, P2Y12 inhibitor monotherapy might be preferred over aspirin monotherapy for long-term secondary prevention in patients with established coronary artery disease.